Hello everyone, this is Dr. Aditya Gupta, and this is the second part of the declutter series. And so a lot of you asked some doubts, not major doubts. Hopefully, I was able to clear most of your doubts regarding which books to purchase. Gave the link of my playlist as well, and which video resources you can use. Again, I'll reiterate: standard textbook reading over video resources. They can be an adjunct. I personally would not recommend any video resource, especially in first year. Now, moving on to the doubts that most people had. The first question, sir, for general anatomy, do we need to buy the BDC book or is it optional? So I would say it's mostly optional. I did not personally read it, but I did buy it. It's not like I did not buy it because FOMO to hota hi hai, so you would end up buying a lot of books, especially in your first year of MBBS. But if you have a friend who can lend it for you for over a day and you can just briefly brush through it, that's more than fine actually. You can even get it photocopied. You don't really need to spend 500 rupees for that book. I think it's that 300-500 rupees ki book hai. Mostly optional. So the answer to your question is it's optional. Yes, if you think it's optional, yes, I do believe general anatomy mostly is optional. Now, because most of the concepts, ki abduction kya hoti hai, adduction kya hoti hai, these are taught to you in the tutorials in the anatomy itself, that adduction is coming, coming to the midline, abduction is taking out from the midline, flexion is, angle decreasing at a joint, extension is angle increasing at a joint, so on and so forth. Now, they ask ki, sir, this is a very interesting question and the most important question someone asked. So a lot of you will be familiar with the fact that you guys are most likely going to have something called as Next. And Next is going to have 90% syllabus from third and fourth prof. And only 10% syllabus from first and second prof. So Genius asked that, sir, agar first and second prof से सिर्फ 10% आने वाले हैं and third and fourth prof से actually में 90% question आने वाला है. So tell me what to read in first year of the third and fourth prof subjects. So I will give you an analogy to realize how foolish this question is. नीट का सिलेक्शन के लिए 11th and 12th का सिलेबस आता है. Now imagine a sixth standard child asking you guys have just cleared NEET, right? कि 6th standard में हूँ मैं या 7th या 8th standard में हूँ. 11th 12th ही आती है. I will leave my 6th and 7th standard studying. Tell me what to read in physics of 11th standard. This is that dumb a question, and I'm not the person who has asked this. I'm not telling you that. It's good that you actually asked this because a lot of you are now in the habit that अभी से नीट पीजी के लिए पढ़ना शुरू करते थे, अभी से नेक्स्ट के लिए पढ़ना शुरू करते थे. भाई, you will burn out in 2.5-3 years. You cannot study for a competitive exam for 4 continuous years. It's impossible. And more importantly, if the exam is going to ask only third and fourth prof, then the best time to study that is third and fourth prof only, not first year. And most importantly, you won't be able to understand anything in the third and fourth prof if your basics of first and second prof are not clear. So you won't be getting anything, you won't frankly understand anything of the third and fourth prof books till the time you don't understand anatomy, physiology and biochemistry. Pediatrics में genetic disorders, inborn error of metabolism, they take their basis from biochemistry. You won't understand ENT till the time you have understand what ear anatomy is. So in first year, please focus on building your basic concepts. These basic concepts are going to make you a good doctor. Don't be in the race right now itself. भाई तुम ऐसे तो स्पर्म थे तभी बन जाते, तुम लोग पढ़ना शुरू कर देते नीट पीजी के लिए, नीट यूजी के लिए और एसएस के लिए. The best time, everything has a time and a place. The best time to study for next, beat next or NEET PG, whichever exam is going to be conducted, is mid of third year. Just like you did 11th and 12th standard in 2 years, and those who didn't do in 11th and 12th standard, they took a drop. If you properly studied in 11th and 12th standard, you know that you can clear NEET. Similar NEET UG. Similarly, if you study properly in third and fourth year, you will be able to crack either next or your NEET PG. In first and second year, please read standard textbooks and make your concepts clear. This was the most important question. And please don't right now focus on, कि मेरे को वो वीडियो देखनी है, मेरे को क्यू बैंक सॉल्व करना है so that मेरा एग्जाम अच्छा हो जाए. And this is the reason in my last video also I did not recommend Maro. Even वो 4-starrer थे as far as teachers were concerned. But क्यू बैंक के लिए Maro मत लेना, बहुत ही wasteful exercise होगी. Try to take if you want something video-ish, then take a video, पहले एक बार 1 month कर लो, go through your MBBS, you'll realize which subject you're good at, which you're bad at, which you need a resource, and then take appropriate resource from that video, giving the pros and cons of each and every platform that is there. Next question, is there any need of review books? Again, the name of the review books that I told you, they are MCQ based books, again from a NEET PG point of view. Not right now. They are written in a concise manner so that you're preparing for NEET PG. They're essentially notes. तो वो नोट्स अभी उनका कोई पॉइंट नहीं है. जब नीट पीजी के लिए पढ़ रहे होगे तब उन नोट्स, उन रिव्यू बुक्स और एमसीक्यूज का पॉइंट है. अगेन थर्ड एंड फोर्थ ईयर मे बी यू कैन, इन ऑर्डर टू रिवाइज फर्स्ट एंड सेकंड ईयर, यू कैन यूज दोस रिव्यू बुक्स. No need of review books right now. What was my routine? So I got a gold medal in biochemistry. I got 77, a distinction in anatomy, and almost a distinction in physiology as well. I got 74%, just 8% negative distinction. Now, what was my schedule? So you have to remember, in MBBS, you don't need to study like NEET UG. You don't need to study 10-12 hours a day. You just need to be able to study 2-3 hours on a daily basis, and that is more than enough. So my college used to be from 9 to 5. 9 to 5 used to be my college. After that, I used to come home and sleep for 1 hour. I used to take a proper nap. Then I used to do 1 hour. Either I used to go play badminton, थोड़ी बकचोदी कर लेता था, दोस्तों से गप्पे लगा लेता था, something on those lines. And at 7:30, I used to go to the library and study properly from 8 to 10. This used to be my entire schedule. कि 1 घंटा सो लिया, 1 घंटा मस्ती मार ली, 5 बजे आने के बाद 7:30, 8 o'clock I used to go to the library and used to properly study for 2 hours. Those 2 hours of dedication daily I used to definitely do. Okay, come back, eat dinner, 10:30 dinner finish हो, try to study for 1 more hour, 11:30, 11:45, come back to the room, and before going to the sleep, I used to watch one episode of House. This was my favorite thing. I used to love House, watching House. You can also watch House. You can download it, or you can Amazon Prime Pay. It's available if I'm not wrong. A really good series, House, and you know, you'll get the feel of being a doctor, House MD. And just before going to sleep, I used to read Lippincott. I loved Lippincott as a book, and used to read Lippincott for 15-20 minutes of the topic that was going to be lectured in the next day, and that made me prepped up for the next day, just going before going to sleep. And I used to sleep at 1 o'clock and wake up at 8 o'clock, proper 7 hours of sleep before going to the college at 9 o'clock. All right, now coming to the how do we study simultaneously for university exam and NEET PG? Again, not the time to study for NEET PG. Right now is the time to focus on concepts. Read your standard textbooks. Those standard textbooks and the concepts that you build are only going to help you in NEET PG. So don't specifically study for NEET PG. There is no point studying for NEET PG. If your concepts are good, my biochemistry concepts were good, my anatomy was good, my physio was decent, these things only later helped me during when I was preparing for NEET PG. I did not need to specifically study for NEET PG to get a good rank, to get a really good rank in my AIIMS entrance examination. You just need to study for your first year professional examination, study for them and focus on concepts, focus on reading standard textbooks. NEET PG ho jayega. Next question, again something similar. Since I keep on talking about first aid for NEET PG preparation and INIS AT, that is AIIMS PG entrance examination preparation, a lot of you like, should we start studying from first year itself? Nahi. Again, I'll reiterate, everything has a time and a place. First and second year is the time to build concepts, not prepare for NEET PG. Third and fourth year is the best time to start preparing for NEET PG, and that's when you can probably pick up first aid. I would advise the book best picked up in fourth year or internship. You can start from third year itself, but not in the first and second year. First and second year is meant for reading standard textbooks properly and getting your concepts right, which are going to stay with you lifelong. Robbins concepts, Guyton concepts, Harper and Lippincott concepts are the things that still save me, are the things that still with me. You learn about sickle cell anemia. You learn about what is the sticky patch, why HBS causes a sticky patch. Remember the sticky patch term. That thing is still stuck with me because I learned it properly during the Harper and in the, your Lippincott. All right. Now, what about clinical based books? This is an important question. So the only way you can actually prepare for NEET PG right now, थोड़ा बहुत हल्का सा आइडिया लेने के लिए कि कोई क्लिनिकल बुक्स कौन सी होती हैं. So there are clinical books called as case files. I have made a video regarding that as well. I'll give the link in the description and in the pinned comment as well. कि case files you can download from LibGen, no need to buy them. And जब भी कोई टॉपिक पढ़ो तो case files से वो cases देख लेना कि वो जो तुमने अभी preclinical anatomy अभी पढ़ी है, the biochemistry that you have just read, the physio that you have just read, how is it going to be applicable in a clinical scenario? How is your patient going to present? These case files is just cases based on those concepts. So first you have to understand the concept, and then you can read case files to understand those concepts in a clinical manner. All right. Again, you don't really need to buy these books. LibGen से ले सकते हो, download कर सकते हो. Next question was that is Langman sufficient? Yes, Langman is sufficient. I said it's IB Singh because most students use IB Singh in most colleges, and even IB Singh is a decent book. But I personally prefer Langman is a better book, and Langman is mostly sufficient for embryology. Now, most important question, Southeast Asian edition or international edition, whichever is cheaper. Both the editions, as far as the content is concerned, are mostly similar. Even if you look at the South Asian edition, they have specifically written only for sale in India, Pakistan and Bangladesh. So basically these books are very, very expensive in the Western nations. All right, they cost around $100, which is 8,000 rupees, 10,000 rupees, and obviously they know that you can. Indian student probably cannot afford a 10,000 rupee book, so they specifically bring out Southeast Asian edition, which are decently and moderately priced, along with certain editors of India which have tweaked the book for the Indian subcontinent, the things which are seen here more. So Southeast Asian edition is the better bet. Anytime you get a Southeast Asian edition, you can buy that. Or even if the international edition you want to buy, if it whichever is cheaper, I will say buy that. There is no problem in buying either international edition or Southeast Asian edition. हमारे time पे Lippincott was Southeast Asian edition, Guyton was normal international edition because there was no Southeast Asian version. Both the books turned out to be fine, but the point is buy a standard textbook, either Southeast Asian edition or international edition, whichever is cheaper for you. If Southeast Asian edition is mostly cheaper, then take Southeast Asian edition. Libgen पे international edition is available, then buy international edition. The content is absolutely similar. Absolutely, most of the time, 95%, 99% content is similar. So even if, let's say, you want to download it from Libgen, then download the international edition. There's no problem in that. All right. Same question again, Southeast Asian edition or the original one. Whichever is cheaper, buy that. Southeast Asian edition is just international with minor tweaks and mostly a cheaper version. So if you want to buy the book, then it's okay if you buy the Southeast Asian edition. Grey's Anatomy main या student, obviously student, yeah. The main is for the MD who are doing their MD in anatomy. Okay, it's a very huge book. You cannot finish it in 1 year. You need 3-4 years to finally be able to actually read it. Students edition is what you require. Again, South Asian or it's not on Libgen. यार भाई international edition से ले लो अगर तुम्हें Libgen से लेना है. Whichever edition, whichever is cheaper, you can get that. If you want it for free and it's on Libgen, then get that. You know, the difference between South Asian and international edition is just the South Asian edition is usually cheaper and it has minor tweaks. So दोनों are equivalent. Whichever is cheaper if you want to buy that. Libgen पर अगर international available है free में वो download करने के लिए तो international ले लो, कोई फर्क नहीं पड़ता, right? But focus on reading Genong, Guyton, these standard textbooks, Lippincott standard textbooks. All right. This is my one advice for you. Right now, focus on building concepts, reading standard textbooks. NEET PG की पढ़ाई third year से start करना. Third year में definitely start करना, no doubt about that. But right now, focus on building your concepts. If you feel like अभी मैं NEET PG के start कर रहा हूँ, then you're just like a student who's in 6th standard thinking he's preparing for NEET UG. This is the best analogy I'll give you. Or like a sperm who thinks he can crack NEET PG. All right. You're starting too early, you will burn out, and there is no point actually. All right. No point of starting preparation for NEET PG right now. You will forget most of the things. Pattern gets changed and you'll burn out. There are multiple reasons. 3rd and 4th year, the best time to start preparing and put in all your efforts to get a good rank in NEET PG if that's what you want. But 3rd and 4th year. Right now, focus on concepts. In fact, if you prepare for NEET PG and don't focus on concepts right now, that's going to hamper your NEET PG. Okay? That's it from my side today. Thank you and have a nice day.